UNICEF. The program is called Health Interventions, and joining us live in studio is Lloyd Kwambana, fundraising advocacy officer, and Mason Mutoa, program coordinator, Farm Orphan Support Trust. Forced. Good morning, gentlemen, and thank you for making time.
Good morning. Thank you very much.
Happy Valentine's.
Happy Valentine's.
So, provision of psychological support, information on prevention of violence against children and sexual gender-based violence, and strengthening of referral systems in COVID-19 affected areas. That is what we are centering on today. If you can give us a brief background about the project and the key objectives towards these issues.
Thank you very much. And let me just, take a few minutes just to talk about Farm Orphan Support Trust. It's an organization that is registered in Zimbabwe as a PVO, and our mandate is to support vulnerable children within the commercial farming areas as well as the rural areas of Zimbabwe. So we are here now to talk about what we have been doing as part of interventions around the provision of psychosocial support information on the prevention of violence against children, gender-based violence in COVID-affected areas.
Wonderful. Would you want to add on anything?
Yes, this program basically started, we got funding from UNICEF, and it's funding coming from USAID. And it's a UNICEF-funded program that seeks to intervene and support, especially children that have been affected and continue to be affected by COVID-19. And we are aware that the residual effects of COVID still continue to haunt us and continue to haunt our children. And this program seeks to provide more information, more conversations at community level, and encouragement so that communities take responsibility in terms of protecting their own children.
Wonderful. It is a Zim Papers radio broadcast simulcast. We are live on Nyami Nyami FM as well as on Diamond FM. We want to welcome our listeners there. It is Health Interventions brought to us by UNICEF, and joining us today is Lloyd Kwambana as well as Mason Matoa from the Farm Orphan Support Trust, talking about the different interventions that they were undertaking. So I had asked you to give us a brief background. You can also add on Lloyd or Mason, of the project supported by USAID and BHA through UNICEF, and would also want to know, what were the key objectives towards the issue of psychosocial support, information on prevention of violence against children, as well as gender-based violence and strengthening of referral systems.
Okay, thank you very much for the question. So as an organization, we underscore the complementarity part of the government interventions within different communities. So we managed to identify areas that were in need to respond to as a result of the impact of COVID-19. Specifically, if I'm to narrow our narrative to Manicaland, where we were focusing in Mutare, Chimani, and Chipinge, to underscore the need to protect children, at risk adolescents as young women on the effects of COVID-19, at the same time mainstreaming the psychosocial support as an integrated approach to respond to the effects of COVID-19, but at the same time identifying the community structures that we need to tap on in strengthening the referral system, and at the same time capacitating the community actors to be part of the interventions, because they need to own the program. So if I'm to run away from the textbook definition of psychosocial support, it's basically an integrated approach that unpacks a complete well-being of children in this narrative, to be part of the approach that they need to be capacitated with, at the same time identifying their needs and responding to areas that they need to be capacitated and supported on.
That makes a lot of sense. Where were these interventions undertaken in Zimbabwe, and why did you choose to pick those particular places?
For this program, we actually had interventions in Chimanimani district, Chipinge district, as well as Chimutare district. And why did we choose these districts? It's a very pertinent question because during the height of COVID-19, the Ministry of Health was actually collecting information on the number of people affected by the COVID, and it was prudent for us to actually target districts that were highly affected by the pandemic. And in Manicaland, we have these 3 districts topping up the list, and we felt our interventions would be quite important in ensuring that we continue to protect children, we continue to support communities, because remember, it's also areas that were also affected by the cyclones. Talk of Ida, cyclone Anna, and the communities need to recover. And usually during the emergency situation, children suffer most, and they also need to be supported, and their recovery process also takes a long time. And we felt that the residual effects of COVID, where we saw children living under restrictions as part of the government efforts to curb the disease, using the World Health Organization standards. Most children were also affected in the process. They spent a lot of time in their homes. They could not move around. They could not play. And that is a serious psychological effect on children, and it also takes time for children to recover.
Okay. Can you outline the key interventions that were undertaken from the support of USAID and BHA, and the key results achieved from this program?
Perfect. Lloyd will come in later, but let me just talk about the key interventions that we conducted in during this program. This program started in April up to December, end of December 2022. And one of the key issues was to ensure that we continuously provide awareness raising within communities. So we have a robust awareness raising strategy within Farm Orphan Support Trust, where we actually have a mobile van going into specific wards that were provided by the district authorities. And in each district, we were actually working in 10 wards, and the mobile van would go from ward to ward, discussing issues around COVID-19, discussing issues around violence against children, as well as gender-based violence. And accompanying us within this process were key government ministries, the Department of Social Welfare, ZRP, Victim Friendly Unit, Minister of Women's Affairs, just to mention a few. And these departments from government found it very important to also provide clear messaging on their services that are available at district level. It also, also taking this advantage of also teaching and discussing with communities about issues that are affecting them, especially those that affect children. So it was like a one-stop shop that we have, one-stop center approach that we used as an organization, where services were also being provided on the spot. I mean, if we talk about vaccinations, for example, we had people being vaccinated on the spot by the Ministry of Health officials. We had cases of children being discussed openly, and then getting support from service providers such as the Department of Social Welfare, Victim Friendly Unit. And there were quite interactive interventions or processes that we had to undertake at community level during awareness raising campaigns. That's one of our key activities that we did. And Lloyd made me.
Okay, thank you very much. Another key intervention that we looked at was the case referral, whereby we identify a case that needs to be responded to, underlying the preventative and the responsive methodologies that we use as FOST, together with the Child Protection Society, together with our Victim Friendly Unit, together with our World Vision, among other stakeholders that we're working with. So at the end of the day, we are handling a case, but at the same time, we need to come to the closing of the case, whereby justice is served, whereby a resolution has been reached, whereby a sustainable approach has been implemented to respond to that matter. So case referral was another key element that we looked at.
And you can imagine, because what has been happening is that most children were not being reached at community level. And accessing services at this level, only a few children can do that, but the majority are back at their homes and villages. And what we have done as FOST is to ensure that our social workers continue to visit these children at homes and also work in close collaboration with the local leadership. We have the councillors out there in the villages, we have the village heads, we have the child care workers, which we call CCWs, and our social workers. We motorize them. Every social worker within Farm Orphan Support Trust has got a motorcycle to ensure that they reach as many children as possible. And I want to inform you that during this phase of the program, we're able to reach over 900 children, from the home settings which needed support one way of the other in terms of support. Some needed referral services, some needed just psychosocial support at community level. And we managed to do that through our social workers.
Over 900 children, that's a huge number. Talking of social, psychosocial support, can you briefly explain to us what is meant by psychosocial support and why is it important to survivors of violence? Also, here briefly, if you can also tell us what is also meant by mental health and why is it important to know more about this subject?
Yes, so as I explained briefly, psychosocial support it's an integrated approach that seeks to respond to issues or matters or concerns that are affecting the well-being of a child. So they may come at different levels, be the physical part, the emotional part, the psychological part, amongst other areas that are influenced by the environment that the child is being socialized in, be it the family setup, be it the society setup, amongst other levels that we might refer to in the social environments. But at the end of the day, we are saying the psychosocial support is a model that is sustainable in responding to the matters or concerns affecting a child. But at the end of the day, as forced through this program that was funded by USAID in partnership with UNICEF, we managed to set up kids clubs as an integrated or informative or interactive platform whereby children themselves, they interact on issues or matters affecting them. At the end of the day, we are underlining the issue of community actors that also need to be part of that initiative. At the end of the day, we are saying the children, they articulate the issues themselves, but at the same time, FOST is now coming in to resource those areas through these social workers, through the trained child care workers, as well as the Department of Social Development, which also complements the arm of the government. Because as FOST, we have that multi-sectoral approach to bring on board all relevant stakeholders that help us to cascade all the matters that we would want to drive home. But at the end of the day, we are saying psychosocial support has been responsive through this project that we have been conducting. It's one of our key pillars as an organization to help children to take the center stage in advocating and lobbying for mechanisms that help them to respond in terms of addressing sexual violence, addressing issues of exploitation, amongst other areas. Because you find out even child labor is also a concern that is being addressed through these platforms. The issues of girls at risk, adolescents, to be affected. But at the same time, we are saying those target groups are identified. But at the end of the day, through the PSS, which we can shorten, it helps now to cascade sustainable responses to address these issues. But at the end of the day, we also need to acknowledge how we manage to capacitate the communities through these systems. At the end of the day, we are saying even beyond the period that we'll be operating these areas, the committee has been strengthened enough to respond to these matters by themselves, and yet only UNICEF, be it USAID or FOST, is coming in to monitor the progress that is being done. But at the same time, as FOST, we've managed to strengthen these systems in a sustainable approach.
Yeah.
Wonderful. If you're just tuning in, it is Health Interventions brought to us by UNICEF. It is a Zim Papers radio broadcast, simulcast live on Star FM, Diamond FM, as well as Nyami Nyami FM. And we welcome our viewers on Facebook. It's a great thing that you managed to capacitate the communities. But then I'd also want to know, what were the key challenges that you faced in the implementation of this program?
Thank you very much. You're asking about challenges, but I just wanted to add a few on the mental health aspect and psychosocial support, because we, as Farm Orphan Support Trust, our role is to conduct a preventative mental health service where we are trying to identify and strengthen referral mechanisms at community level. We are not into specialized services, because we actually refer specialized services to specialist services that are provided within the districts and the province. But our role is to interact with communities on a regular basis, identify children that require support, and then refer accordingly. And also in terms of psychosocial support, it's about creating connections between communities, their children, their families, their communities, their leaders, so that they continue to interact and talk about issues that affect themselves. We want children to develop psychosocial well-being, the ability to be able to relate and be able to understand in terms of their developmental needs. So it's very important for us in that regard. Challenges, yes, coming to your question, of course, challenges have always been there, but I think what we have seen is that communities are very eager to work together as a community. We might see that perhaps the way we conduct our business as development practitioners might be fragmented, but there's need for us to continuously to interact together, work together as CSOs and government, improve our collaboration on a regular basis at community level, so that we provide a holistic service to communities that require that service.
Okay. And what other services were needed by the communities? You were in the communities and interacting with people. From what you saw, how did you ensure that they access the service that you're not providing under the USAID or BHA support?
I'll talk about one. The most important aspects that this program actually brought was the need to continuously, handle a conversation that relate to the prevention of gender-based violence, violence against children, and of course issues around COVID prevention. And what we did was to create platforms at community level where communities would come together and discuss some of these things. For example, Lloyd talked about kids clubs, creating safe spaces for children at risk adolescents and young mothers. And around gender-based violence, we felt that young mothers have a fair share of being affected. And what we did with the program is to ensure that we also create what we call circles of support. These are support groups where young mothers come together on a regular basis, on a monthly basis, and discuss issues that are affecting them, be it child care issues, positive parenting issues, and also, identify cases where one is affected and who does not know where to report the case. And the group, with support from local stakeholders, they are able to support this particular case. So these are the services that we are trying to strengthen as Farm Orphan Support Trust, that we have what we call community-based reporting mechanisms, which are identified by the communities themselves, which are safe to use, which are friendlier to use, so that people will come together, people come forward to report any case that they feel they need to be supported on. So this has been an ongoing conversation, and which still needs to be strengthened as we continue with the programming process, that we need people to develop their own community-based reporting mechanisms, which we need to strengthen, and then people are free to use those services.
Yeah, sure. If I may add, maybe my point of departure will be to acknowledge the funding that we've been getting from USAID together with UNICEF. But the narrative that requires continued support is the issue of prevention of sexual exploitation and abuse of at-risk adolescents and young women. you'd find these interventions are not a one-day service, but it's an ongoing process that requires to be strengthened time and again. But if you have noticed, through this project we have focused on 3 districts, not knowing and not also be sure that there are also other areas that we need to look at. That is a fact. Many districts are in need of the same support, so we also need to cascade that same narrative to the other districts, but they are also affected. As forced, we base our programming based on a body of research. Recently, we conducted a study on the sexual violence affecting boys in Zimbabwe. That we worked together with the Ministry of Public Service, Labour and Social Welfare in November 2021. So the study it clearly highlights that there is need for boys to be integrated in this discourse, to discuss how they are affected sexually. But at the same time, we also need to underline the friendly and effective reporting mechanisms to address all these issues. So it's an ongoing process that we need to continue talking about each and every day. And the same narrative has to be equal, both the boys and the girls, because both are affected sexually.
Love that, the inclusion of the boy child, because we hear a lot of people just also a lot of men crying and saying you are leaving out the men in this, but then in some cases, in as much they are perpetrators, they are also victims, and they also need the same attention. Can you tell us how this programs like these, such as this one, strengthen community-based referral pathways, especially with community health workers or social workers? And furthermore, what of specialized cases referred for support?
Yes, I earlier alluded to that. This program is community-based, and the issues and that communities talk about are the issues that we try as organizations to intervene and support, and strengthen their services. And as I said also, that Farm Orphan Support Trust has made it a point that we motorize our social workers so that they continue to be working together with communities on a regular basis, so that they provide the needed psychosocial support services and also the identification and referral processes. But we also have issues around capacitating communities leadership and community actors like the CCWs, the ward community coordinators, the behavior change agents within communities to continuously support each other, because at the end of the day we want to build a process of community strengthening that would ensure that communities are able to manage their issues together. We have issues around psychosocial support where we have talked about protective factors around children. People need to understand that in terms of PSS, there are also other factors that also need to be looked at, which also protect children. Things like the leadership, the family as a unit, the extended family, kinship care, which we are now talking about as much as possible, so that people take responsibility about child care. We also want to talk about issues around structures within communities to support children, their own children, the churches, traditional groups, traditional leaders, village community structures that should come together and assess how their children are faring. We want to improve and strengthen the Ubuntu system, that children are there because communities are also there. So they need to also have a responsibility to also to look after their own children. So that aspect of referral systems, accessibility of services has to be put in place at community level so that children get the services as closer as possible.
Wonderful. In a minute, can you explain to the audience what is training in PSS, prevention of COVID-19, the VHC and SGBV? What does this entail at a practical level, at community levels, and even in households? I know we're running out of time, but then if you can shorten that response.
Okay, I'll touch one component, then Mr. Mato will touch another component. Basically, when we talk of VAC, we are referring to the violence affecting children, whereby we are saying if children are affected, are they aware are they averse of these issues, and how are they supposed to respond in addressing these issues? Because we are saying children need to be in a safe space. A home should be a safe space, but at a certain point, the homes are also the areas where children are being violated physically, sexually, verbally, amongst other areas of abuse. But at the end of the day, we are saying we need to create a framework that responds to issues affecting children in terms of violence. But if you are to talk of sexual gender-based violence, it cuts across both genders, be it boys or girls, be it men and women. But at the same time, as forced, we are strengthening, we are responding to those issues and say we need to take up our arms and respond with the relevant partners or department to respond to these.
Thank you so much. Unfortunately, we have run out of time. Lloyd Kombana and Mason Matoa from Farm Orphan Support Trust Forced. And we are back with health interventions next week, Monday, Tuesday, same time. It is brought to us by UNICEF. We appreciate you so much for listening. Check your time with mine. It is 12 midday, time for Now in Daba.